Hi, I'm Dr. Leonard Karadimas. I'm an orthopedic hip surgeon in Port Huron, Michigan at Advanced Orthopedics, and I want to talk to you today about direct anterior hip replacement surgery. Why people have hip replacement surgery? Well, typically because of symptomatic osteoarthritis. I have a little model here of a hip. You have the socket, you have the ball, and then you have the smooth, shiny cartilage at the end of both areas. And over time, that smooth, shiny cartilage can wear, and that's what arthritis is. So I have another model here. I'm just going to pull this out and put in the arthritic hip model and show you what that looks like. That's what we're talking about. That cartilage at the end of the bone, in the socket, and at the end of the bone has worn out. And that is very symptomatic, very painful for people. Groin pain, difficulty putting your shoe on, your sock on, difficulty walking, limits your ability to ambulate, to walk. Typically what we do for a bad hip is replace it. And traditionally, for decades, you would go into the hip either through the back side of the hip, a posterior approach, or off to the side of the hip to get in there and basically resurface the hip. What do I mean by resurface the hip? Well, basically you would remove the worn out edges of the worn out socket and replace that with a metal and plastic socket. I'm going to reach in here and grab that for you here in a moment. Metal back, plastic liner, that would be your new socket. And then what we would do is create a new femoral head, a new ball, by cutting the worn out ball off and inserting a stem into the femoral canal that has a ball attached to it, and that would be your new hip right there. Traditionally, that is done through a posterior or lateral approach, and that certainly has worked well for a long time. We've been able to help a lot of people out with disabling hip pain. In today's day and age, however, I can perform this, and lots of surgeons in the country are doing this through an anterior approach. Why an anterior approach? Well, several reasons. Number one, when you go through a posterior approach or a lateral approach, you have to actually detach muscle, cut through things, and ultimately reattach them and cause some damage. And that certainly leads to a longer recovery. And in certain populations, you can have some permanent, long-term issues like a limp. Through the anterior approach, you're making a 4-inch incision through the front of the hip, and not detaching any muscle at all. You're actually spreading the muscle apart, and you're able to get in there and reconstruct your hip with no cutting of any muscle, which is going to lead to a much quicker recovery and really limit the chances for any issues like limps. Another reason is for placement of the actual implants. Traditionally, we'd go in there and remove the worn out socket, put a new socket in, a new ball, and kind of eyeball it. You get a good idea of how things look, and it looks pretty good, and you implant things, and then you reattach the tendons, and then take the patient out of the operating room into the recovery room and take an x-ray and make sure everything looks okay. Well, the surgery's done. And most of the times it looked pretty good. Tolerable. I mean, there's obviously tolerances. You can have a little bit a 5-degree tolerance in the cut, perhaps, or a few degrees here or there, and it's satisfactory. But with an anterior hip replacement, we actually do it under a live fluoroscopy, a live X-ray. So as we're putting the implants in, you're actually able to see it right there in the operating room. It gives you precise positioning of all our implants. So we know where those implants are going right during the surgery, both the socket and the femoral stem. So once we implant those, we know they're perfectly positioned, and once you leave the operating room, we know that those implants are exactly where they need to be. Traditionally, hospital stays for total hip replacements have been 3 or 4 days. With the anterior total hip replacement, direct anterior approach, 1 to 2 days. Traditionally, you've been in a walker for up to 4 weeks. With the anterior total hip, a week. Recovery is fast. People do well. Implant positioning is always going to be perfect. If you need a new hip, have an anterior hip replacement done right here at Advanced Orthopedics by myself, Leonard Karadimas. Thanks.